We are so excited to have them join us today and their expertise. We will have a question and answers at the end of the presentation. So if you have questions during the event, feel free to enter your Q&A at the bottom of your screen. And then once they're done with their presentation, we will go through all the questions and help answer them. As always, this is recorded and will be available 24 to 48 hours after our presentation today. I'd like to take some time to thank our sponsors, whom without we would not be able to make this possible. Bristol Myers Squibb, Amgen Oncology, CaroPharm, AbbVie, Adaptive, Genentech, we have Oncopeptides and Takeda Oncology. So it is my pleasure to introduce our speakers today. We have Jens Hillengass, MD, PhD. He is a professor of oncology and chief of myeloma and amyloidosis service at Roswell Park Cancer Institute in Buffalo, New York. And prior to joining Roswell, he was the deputy of the section multiple myeloma of the University Hospital of Hildenberg, Germany, the leader of its autologous stem cell transplant program, and head of the oncological, I apologize, imaging research group at the German Cancer Research Center, DKFZ. He completed his medical degree at Hildenberg University, where he later completed residency and fellowship in the Department of Hematology, Oncology, and Rheumatology. Dr. Hillengass received a Garrick Scholarship to study radiology at the German Cancer Research Center. Additionally, he completed a research fellowship at the National Cancer Institute. Dr. Hillengass is a member of the Black Swan Research Initiative of the International Myeloma Foundation and the International Myeloma Working Group, where he co-chairs the Bone and Imaging Group. Michaela Hillengass is an RN case manager and ACSM certified personal trainer. She is an exercise trainer and study coordinator at Roswell Park Cancer Institute in Buffalo, New York. Prior to joining Roswell Park, she worked as a case manager in the myeloma department of the Hildenberg University Hospital and took care of patients coming in for the first appointments, and also patients preparing for their autologous stem cell transplant. Before that, she worked as an RN with a specialty as a pain nurse in the infusion clinic for 7 years. Prior to that, she worked in several departments of a local hospital, amongst others as head nurse on a ward in South Germany, where she also had her nursing training. She has been a member of the IMF Nursing Board since 2020. So welcome. And now the time is yours for your presentation.
Hi, Lindy. Thank you so much for the nice introduction. We really did not make it easy for you. We apologize.
That's okay.
So yeah, coming back to, bone disease was kind of the obvious thing that stood in our way because we didn't want to let patients work out and then they get fractures, obviously. So we were very careful with that. But we think that patients with bone disease might actually benefit from workout. Back in the day, we told them, go to bed, sit on your sofa, don't do anything. But as you all know, that myeloma patients' bone destruction is more active than bone resorption, bone formation. And we all have that, independent of myeloma or not, that we have so-called osteoclasts, which are eating up our bone, and osteoblasts, which sit right next to it in the neighborhood and rebuild the bone. So we have a constant bone turnover. And the only thing in myeloma is that these osteoclasts, the bone-eating cells, are overactivated. That's kind of the baseline that we come from. And now we know, and unfortunately, most of you might also know, that 90% of patients show osteolytic lesions, changes in the bones caused by this activity. 20% have the bone disease show a 20% increased mortality. So just having destruction in the bone and not doing anything about it increases your mortality, which is obviously something we want to work against. About 80% of patients suffer from pathological fractures, which is just far too many. And not doing anything will weaken your muscles, and then you are even more susceptible to fractures. So important reasons for this morbidity, why patients feel sick with bone disease, is obviously the pain, but also the fractures, which can cause neurological issues when they put pressure, when those fractures put pressure on the bones. That's also something that is, of course, bad. And when these bone eating cells are overactivated, they get calcium out of the bone. So that's another thing that we have to deal with in myeloma bone disease. And this is, you can see, the highest risk to have bone fractures is at first diagnosis. The 0 in the middle here is the date of diagnosis. And they saw, obviously, that when you have the diagnosis, then is the highest risk to get fractures. Later on, there's still a risk, but the risk is much lower because we know the patient has myeloma and we try to treat it, and most patients go into remission. Why do we know that not doing anything with your muscles and bones causes bone loss? We know it from astronauts, and these are astronauts, and you see these very sophisticated machines that they need because obviously they have no gravity. So when they came back, you might remember, some of you might remember the film when they come back from space and they are in a wheelchair. I mean, those people are the fittest of the fittest. They would not go into space if they were not. And even those people come back are in a wheelchair. And that's why a lot of research went into how they can remain fit, can keep their muscle mass, and they can keep their bone mass. And that is something that inspired us, because we know those people lose bone mass, and we know myeloma people lose bone mass. So obviously exercise, it's what you see here from these guys, might hopefully also help. We also know that myeloma osteolytic lesions can recalcify, as we call it, or remineralize. We see with modern imaging that patients after treatment with bisphosphonates and rank ligand inhibitors, so those bone protective agents, but also with the kind of the good myeloma treatment, a patient comes into remission. And on the right side, you see how this large osteolytic lesion starts, the body starts to heal. And we think we can contribute to this healing process by giving the patient exercises that they can do safely. Another factor we would like to look into, and we know that also from other cancers, but also for healthy individuals, exercise improves our immune system. There's pretty good data showing that when we work out, our immune system is boosted and gets more help. Some certain cell types, and there are a lot, you don't have to learn this by heart, but a lot of things are going on in our immune system, and we need our immune system, one, to keep the cancer under control, but also to use the immune system to attack the cancer cells. You know, antibody treatment, you know, immunomodulatory drugs, you know, CAR T cell treatment, and this all engages the immune system. And if the immune system is weak, then all those drugs might work less. This is our hypothesis, and we are trying to optimize things there. This is a very good review about the effects of exercise on the immune system. You see, again, a lot of different cells, and there's a lot of knowledge, mostly from animals, but some even from human beings, that there is a positive influence of exercise on the immune system, in this case, in hematologic diseases. And now I hand over to my wife, and she will tell you about the study that we think is the best in myeloma so far, or that includes myeloma patients.
Yes, so I just want to show you briefly this trial. It's called ACCESS trial. It's exercise in individuals after stem cell transplant. That's why the name come up with that. I did research in articles about exercise with myeloma patients, and only a few trials came up, I think 7. And this is one of the best we could find because it's also very close to what we do here at Roswell. And unfortunately, there are only 29 myeloma patients involved. They also had other patients with hematologic malignancies involved. They, after stem cell transplant, they randomized them into either a standard of care group or the exercise intervention group, as you can see here on this picture. And then they did 18 weeks of supervised exercise. It is a combination of strength training. They did 6 exercises for the muscle groups. And then it was starting with a interval training and ending with an interval training. It was about an hour and over 18 weeks. That was what it's about. And the interesting thing there is that they not only got the training, but also some counseling sessions, which helped them to get more information about how do they exercise this correctly, and some background information and how to pursue an active lifestyle. They had some endpoints and they measured the grip strength and some cardiorespiratory fitness, also some questionnaires, which is similar to ours here at Roswell, and I talk about that later on. And the body composition was very interesting. Oops. Yeah. And what we got out of that is that counseling is a very important tool to help people to stick to a program, because it's not always easy to put that into all the busy life that comes up sometimes. But unfortunately, that was 2017. They didn't get a lot of significant benefits out of it. The results were rather vague. And we think, when we read the article, that it might be because the control group also had patients with exercise and active time, which was not really helpful to compare them. And some people couldn't comply to the intervention because it was just too busy for them. So in further literature review, I found only a small number of studies, seven clinical trials, and lots of them were very vague in their results. Some are still pending, so there is not a lot of results, and we really think we are on a good path with our trial now here at Roswell to get some answers. Some findings we already had, at least, were that they really got more muscle strength, and the body composition changed. They got more muscles. And one study was really interesting. They started doing exercise even before patients got their transplant. And during that transplant phase, they needed less transfusions because their blood cells were just in a good range. So that is very interesting that we can impact that with doing exercise. Yes, it was not really very successful with that trial. Some trials didn't achieve even the recruitment goal. And so the things we saw in retrospect, that most of these people writing this article said, oh, we need more supervised and long-term trials. Some trials were just for 6 to 12 weeks. This one trial I showed you was 18 weeks at least, but it needs more time to get better results. And it's also very important to have a very personalized, individualized exercise program, which you will see later on why.
Okay, now I take over again. We work with HealthTree to learn what is really going on. What do patients do? And we send out questionnaires via HealthTree. And I saw Nathan is on the call, and we are very grateful for all your help. So we send out questionnaires through HealthTree regarding pain, a very easy pain scale. You all know 0 is no pain and 10 is the worst pain you could imagine. So we send that and ask the patients, what is your pain level? We ask for fatigue to see if we know that patients have a lot of fatigue. And actually, to my knowledge, the only treatment of fatigue is exercise. So we asked if the patients have fatigue, and you see the questions here. And you all who have not contributed can definitely log into HealthTree later on and complete these questionnaires, because we learn a lot from them. We asked about distress, because obviously having a diagnosis of myeloma is very stressful, and it also influences your quality of life and your activities of daily living, as we call them. And here is a distress thermometer, and that is also something that we ask our patients to fill in. And the backbone of the whole study that we're doing, this retrospective analysis or cross-sectional analysis, is asking the patients how much do they do exercise or physical activity per week. Of course, that's a very wide range. It could be gardening, it could be, I don't know, running a marathon. But we ask how many hours per week do you work out? And we asked specifically, what did the patient do before they were diagnosed? What do they do now since they have their diagnosis? And also, what would they like to do, and how important is the exercise or activity in particular for their quality of life and for their life as specifically. We were blown away by the number of patients who already participated. Over 600 patients answered those questionnaires. Most patients had myeloma. The median age was a little bit younger than myeloma age, according to the usual statistics. So 64 years of age was the median age. Female a little bit more than male, which usually men have more, are more common to have myeloma, but we also know that women are more likely to fill in questionnaires. So that's not too much of a surprise. What I find challenging is that the race distribution in this study was obviously not really representative, because as most of you know that Black people have a high risk to develop myeloma, but the people who filled in the questionnaires were mostly Caucasians, which is still representative, but we would love to have more people of color filling in, and also Asian Americans, because there are some differences and it would be very helpful. It was more people who had a higher degree of education, which is also, I guess, yeah, not really surprising, and doesn't have an influence on our findings. The results further on was that the BMI was actually slightly elevated, and over half of the patients had fulfill criteria for obesity, which is pretty strict, but this is something that is interesting, but something that we can influence with workout. Bone pain was very prevalent, as we already mentioned. A lot of those patients who filled in had fractures, and also even had to spend time in bed because of their myeloma. Exhausted is the question with the fatigue again, and a lot of patients have this. Lack of energy, I fear that most of you know about this. Sleep issues, less than 6 hours per night is really not great, even for a nurse and a doctor. So less than 6 hours per night, a third of patients mentioned that. Sadness and depression is also very prevalent. And then we looked what activity level do patients have, and before illness, 80% reported that they had more than 2 hours of physical activity per week, while only 64% reported this now at the time of the questionnaire, where they have their diagnosis already, and 90% would like to do more. So we know there's a large discrepancy between what patients can do and what they would like to do. and most patients said physical activity is important for them. We would like now to talk about a few projects that we are doing, and some of them are remote, so you can enroll. Also, some studies are planned with Health Tree again, where you can participate if you are in Health Tree. And I would hand over again to Michaela to talk about what we are doing right now.
Yeah, I just wanted to tell you a bit about our project here at Roswell Park, and I feel so blessed for all the patients that are participating right now. It's such a blessing to work with them. So this study is a pilot study. That means that we want to get data and collect them so that we can prove all the benefits we already know that will be there, and maybe even more. With this study, we also wanted to see, is it feasible for myeloma patients to do that during their walk through their treatment or walk through all these side effects. For now, I can say that it is feasible and it is safe. There are things you can do and that really help to improve your life. Yes, and other endpoints you can see here on this slide is the fitness itself and the bone turnover. Yeah, we really want to see if, especially doing resistance training, helps recalcify the bone structure and can therefore support the treatment with the things we right now have to give. And we also want to see what impact it has on your daily lives, on the pain situation and the fatigue, and especially maybe also the neuropathy and depression. So therefore, we give everybody who participates a fitness tracker. Oh, I have mine not here. For 6 months. And we want to see how their steps, how many steps they can get in during the day, and how many active minutes, and also their sleep patterns. We have 2 cohorts right now. We started with cohort 1.5 years ago, but we had to stop that due to COVID. Therefore, we can't right now not enroll as many patients as we want to, but we are working on that. The cohort 1 means this supervised resistance training here at Roswell Park, and we are very blessed that we can use the facilities of the rehab department. That's very nice. And people have to come in 2 times a week for 26 weeks. That sounds a lot, but I have the impression that it flies by faster than it is. And 2 times a week for 1 hour, and it's a combination of cardiovascular training at the beginning and at the end for 10 minutes as a warm up and as a cool down, and then it's followed by 40 minutes of exercise strength training, and I show you later on what that means. Cohort 2 is for patients who can't come in because they are too far away. So they get their Fitbit, and every week they will get a prompting on their Fitbit or on their phone to increase their active minutes at home, so that they increase slowly over time. They start with 150 minutes per week, which would be 21 minutes per day. And you don't have to do that every day. You can accumulate that during the day, doing 10 minutes now, 10 minutes later, or something like that. And at the end, they do 300 minutes. That would be 42 minutes per day. It's quite a lot, but you can do that with walking the dog, or maybe you have a elliptical at home or something like that, doing gardening. Everything that gets your heart rate up. So Oh, and then also every 3 months, patients come in for an assessment so that we can see how they progress, how they do over time. And we also want to see how the immune system changes. So we want to have 1 tube of blood every 3 months to see what impact that has. These are some exercises the patients do in our study group. You can also do them at home, but first you have to check with your oncologist if you have any limitations or there are any issues you should take care of first. So I chose these two, for example. These are multi-joints exercises. That means that you work with more than one muscle group, and they are very good in getting stronger. And you have lots of ways to do that. You don't have to do it like the ladies here with going very deep. You can also have support, or you can add some weights, some resistance bands to make it more interesting. These are also very good exercises, especially for your core and for your back. You can do the bridges, which will be on the top here. Yeah, and then the bird dogs, where you be on your knees and on your hands, and the push-ups. These are also exercises you can vary a lot with resistance bands or with variations with the legs and hands. And these are some exercise examples for using some resistance bands. And that's it from my side. Oh no, I have one more slide. I just want to tell you, we can't show you some results right now, scientifically proven, but I got a lot of feedback from my patients that they can do things in their life they couldn't do before they did the exercise, like opening a bottle of juice or getting into the car much easier. They are much less tired after the chemotherapy. So there are really lots of benefits you can even see after a few exercise bouts already. Thank you so much from my side.
Okay, and what are our future plans? We want more patient groups. We also want to try out what we can achieve in early stages, like smoldering myeloma and MGUS, because we know that there's even in these stages some changes in the immune system already. So we think we hopefully can help patients. What Michi already mentioned is that we want to improve for patients who are on treatment, that we want to improve the side effect profile. We want to combine different exercise programs. We want to look more into bone health. Unfortunately, we didn't have the funding for now, so we now have funding acquired and would like to look into bone health more. We are in negotiation and discussion with other colleagues regarding nutritional interventions, because we think we cannot only achieve things with exercise and physical activity, but also with nutrition. Assessment of stress. What is the effect of workouts on stress? And there are some things that we can do to improve that. And as I mentioned, side effects of treatment. As I mentioned, what we would like to do with Health Tree is a 6-month intervention, this 26 weeks, with Fitbit promptings, as we already started with colleagues here and with patients here. We are not sure with the strength training, and everything that Michaela mentioned are great exercises, but if you have an osteolytic lesion in a certain area of your body, you will have to ask either your oncologist or an orthopedist if you are cleared for a certain exercise. What we are doing here with our study, every single patient who wants to participate in the study will have a so-called tumor board. We will look at the last imaging, a PET-CT or a CT or even an MRI. We look at those with our radiologists and with our neurosurgeons, and they give us the okay, patient can do either everything or patient can do certain exercises. And we really want to be very, very careful. Don't take away from this talk that you should go to the gym tomorrow and lift heavy weights. It depends very much on how your bones look like, what you have done before, and a lot of factors. You should definitely first consult your physician before you do that. Questionnaires we want to send out again and see what the effect is of our intervention. And we, as Michaela mentioned, we want to see with blood samples, what's the effect on the immune system, what is the effect on stress markers like catecholamines, and what is the effect on the bone health with some bone turnover parameters. So these are all things we would like to do remote, and we are not sure how we can implement the strength training. We are now learning that patients really have not a lot of side effects from this training, but we, of course, if something happens and we are not there to help them, that is a huge issue, and we're working on things that we can offer patients that they are really safe, because safety first. With this, we'd like to thank our team and thank you for your attention. Yes. And we are really looking forward to questions. And I think we stop sharing our screen so that you can see us if you really want to. And I'm not sure if you're moderating, right, Lynn?
Yes.
Lindsay?
Thank you. I absolutely enjoyed all of that. I love hearing about what you're doing and how this is going to help our community. And we just finished our Move Spring event. So with March, we did a fitness challenge, and we were encouraging patients to exercise 20 minutes a day. And we had almost 800 participants, and we were doing it for minutes based. That way it's not steps, so people can swim or bike, whatever. And we hit, it was 780,000 minutes for the month. So we had an incredible month. So this presentation coming off of such a high with all that they participated in, it's amazing. So we are going to go into our questions, and we've got some great ones. So our first one from Jackie, she said, how do you feel about incorporating yoga into exercises?
I think that's a great way to do. There are some movements you have to be cautious, because bending or tilting can be a risk. But otherwise, I think it's a great exercise. It's low impact, and that's good to do.
Awesome.
But again, check with your doctor before.
Yes, exactly.
Right?
Yeah, always talk to your doctor. Modify. It's always a good one. All right. Iris said, I was an avid competitive hockey player. I am in remission. I have been working out ever since I regained my ability to walk after 5 compression fractures. So it's been 2 years. Do you think I can skate again?
In general, so skating is great. Falling down either on the tarmac or ice is, of course, not good. Someone who has always done that has usually good reflexes, but I mean, treatment changes that to a certain degree. So be very careful. Again, ask your doctor. I mean, you already had compression fractures. The problem is that every impact, and that's what we learned from our orthopedist, every impact that kind of has an impact on your spine is dangerous, and falling down and falling on your butt basically is not good for your spine. So I would be extremely careful with this. Again, someone who is very experienced has a lower risk in our experience. But a challenge is if you don't have your own pond where you can skate, ice skate, for example, someone else can run you over. And so I'm a little bit careful. What we usually try to recommend is low impact sports, even though we know that impact has a positive effect on the bones. But because of the fracture risk, and if you already had compression fractures, you obviously have something going on in your spine. Impact is not good, but staying in the same level of your body. Don't make extreme turns, don't make extreme bending, like Michaela said, bending or extending. So we rather recommend lower impact sports. As much as my heart bleeds to say no to such a really nice idea, I fear that falling down is the problem. Even if you're very careful, there's still a risk.
Perfect. Jackie also says, since fatigue is symptomatic of myeloma, how much should one push through when exercising?
It depends. If you have other side effects like fever or low platelets, it could be hard to push through. But if fatigue is the only side effect, it sometimes can help to push yourself to feel better. I had some patients and still have, they say, oh, I didn't want to come today. I'm so tired. As soon as they went on their treadmill, they said, oh, I feel better already. So it can really be helpful to push through. Sometimes do it with someone together or have an appointment. Like here in this study, people say, I wouldn't do it at home, but since I have it scheduled, I do it. So that helps sometimes, yes.
Yeah, I think push through to start doing something is definitely worth it. If I would never push through pain as a myeloma patient. If you're healthy and your bones are healthy, then I would not be worried. But if you have bone involvement, you should not push through pain. But with the fatigue and what Michaela said, if it's pushing through getting off the sofa, I think that is something that you should help yourself and kind of incentivize yourself by saying, hey, I will meet nice people. And of course, COVID is bothering all of us, but at least making an appointment, making a plan for yourself and going out. And if it's just for a walk, that is definitely good.
Perfect. All right, Iris says, is it essential that you have to take bone strengthening medications? I have been off of them, but I want to get back on the ice. I am very interested in being part of your study. I also just had a full body x-ray panel done, which can be compared to the old one.
Yeah. So for the bone disease, the bone treatments, which is either a bisphosphonate or a rank ligand inhibitor, that's what the two groups are called. They're rather similar. They have a few differences in their mechanism of action. In general, we know that the myeloma cells and the bone eating and bone building cells are in close interaction. That's one thing what we want to do with physical activity. But of course, those bone strengthening agents have their benefit as well, because we know that the myeloma cells are overactivating those bone-eating cells that we talked about earlier, but also the bone-eating cells get nutrients out of the bone that feed the myeloma cells. So in general, it is good to have those. After a long period of time, those can have long-term side effects, but this is usually not before at least 5 years. It's, again, individually different, but in general, when the myeloma is active, at least, and initially you should at least have 1 year, better maybe 2 years, and also depending on the depth of remission is at the moment the recommendation to get bone strengthening agents.
Okay. Paul asks, should we worry about target heart rate with exercise?
It depends on how your fitness level was before. So if you are rather a sedentary person who didn't do a lot, or at least for half a year, then you have to get your heart rate used to work again. So then it is important to not increase it too much. And therefore, I recommend not to start too vigorous at the beginning. And since they have their Fitbit, they can always check what their heart rate is saying. But if you're already used to exercise, then it shouldn't be a problem.
And again, ask your doctor,
yes,
ask if you have any heart issues, ask your heart doctor just to make sure.
Perfect. Trina asks, where to sign up?
So not yet, but soon on HealthTree, hopefully. So keep your eyes open. We will definitely, HealthTree will send out emails about this. And if you like, again, we are still in the pilot phase, but we hope that we can, got some funding. We hope that we can open up soon. And the plan is to do it remotely. So you can literally, hopefully do it from anywhere in the country. You can find us on roswellpark.org, both of us, and then you can reach out to us when maybe give us, I would say, 3 more months. And if you don't hear anything from HealthTree, reach out to us and we are happy to assist.
Perfect. Nathan asks, may I plug your smoldering myeloma Fitbit study in this webinar?
I think that would be a great idea. Good idea, Nathan.
Carol asks, what are your thoughts about Tai Chi?
That is also very, very effective. I know that some patients did it before they came to my study. I like
Thumbs up.
Yes.
Perfect. All right. Can we turn Nathan's camera on or his audio? There we go. You may give your plug.
Well, thank you. Thank you for giving me an opportunity to give a plug. So yeah, we've been working with the Roswell Park team. They are fantastic. I really enjoy working with them. And they are looking to see if anyone is just what their interest level is. So if you have smoldering myeloma, if you've been diagnosed with smoldering myeloma and are interested in joining a Fitbit study, we have a survey that's available for smoldering patients. If you have multiple myeloma, I'm sure we'll do a study further down the road, but right now we're looking at those that have been diagnosed with smoldering. You can log on to your HealthTree profile, go to Accelerate Research, and you'll find a survey there that you can fill out. It's just 3 questions. If you're interested, and I think there's 2 other questions, and that's it. And then we'll send that information to Dr. Hillengass, and it'll be basically on the list to be included in the study. So if you're interested, please fill it out and we'll be in touch soon.
Perfect.
Thank you so much.
Perfect. Thank you.
All right, more questions. Paul asks, should we do reps for strength or endurance?
That is a good question. I have to admit, I don't get exactly what Paul means with that.
I think it's the number and the resistance that you use, right?
Yeah, so I think he's asking, should he be doing higher weights with lower repetitions or lower weights with higher repetitions? So
in general, that also depends on how you are with your fitness level. It's always good to start with more reps and lower weights. And then if you can do that very well and have the impression you don't work out with that weight anymore, then go higher with your weight. And weights are, as we know, good for bone strength. So, but please start rather with more reps and then increase the weight.
Perfect.
I'm sorry.
No, you're good. No, Yvette asks, I enjoy doing yard work like mowing my lawn. After I'm in remission, will I be able to use a riding mower or is the bumping too much?
So it depends on your lawn, but in general, and again on your bones, right? A bumping lawnmower is the same impact as falling on your butt on the ice. So I would be careful with this. It depends also if you are on a current treatment right now, how your immune system is. So not only the bones, but the immune system is important because every lawnmower produces dust. And the dust gets into your lungs, and on the dust there are bacteria and fungi. And that's one problem. If your immune system is weak, then you should be very careful. I mean, everyone wears masks nowadays, which is a good start. But if you have a big lawn, you might not wear a mask. So be very careful breathing in the dust. And again, if it's very bumpy, be careful with your skeleton. In general, we have learned that gardening and all of that seems to be very meditative for patients, so they like it. But unfortunately, as I said, soil contains bacteria and fungi. It depends. Usually we say don't do it within the first 6 months after auto transplant, for example. If you're in a good remission and you're on a continuous treatment, for example, with lenalidomide or another IMiD, that could be fine, but please talk with your doctor first regarding the immune system and also regarding your bones.
Great. Anne asks, are there limits in pushing to regain cardio fitness that are different than the pre-myeloma limits?
Should I? Okay. The problem with myeloma is always that in the back of our mind, it's not common, but in the back of my mind, at least, is always the risk of amyloidosis. You might have heard of amyloidosis, where the proteins that are produced by the myeloma cells are not excreted out of the system, but you have them possibly in your heart, which then can increase your risk of actually, in the worst case, sudden cardiac death. So that sounds very bad. And it's not common, but it's something where usually when you get treatment, your doctor will do usually an ultrasound of your heart and an EKG. If those are okay, then you can be a little bit more vigorous, as we talked earlier. If there is any chance or any risk that you have either a risk for ischemia, for an underutilization of oxygen, or if you have a risk to have any other heart disease, is actually more important than the myeloma itself. The myeloma itself is not, there's no high risk for that. But because there's this very remote risk that you have an amyloidosis, I would personally recommend that you ask a cardiologist or your oncologist if you are cleared to push through and to be more active in that sense.
Great. Anonymous is saying, when I try to work out, my legs hurt really bad and it is difficult to move. What should I do for exercise? Any recommendations of things that can help them with this?
Yes, I would love to know when it hurts, with what exercises, but doing some stretches helps mostly. So it depends on where you have your pain. It's good to stretch your leg in different ways before you start doing the exercise to kind of warm up your muscles.
Perfect. Bev is asking, will you accept Canadians in your study?
There's no reason not to accept Canadians. There's never a reason to not to accept Canadians. No. In general, we have to see if there's any data protection issue. We hope that we can, I mean, we are so close to Canada, we can go there with our bikes. So we would love to have also Canadians. And yeah, it depends on if there's any legal issue, but I would not think so.
Okay. Jan is asking, I have been on Prolia for 3.5 years for osteoporosis before recently being diagnosed with multiple myeloma in January. I started multiple myeloma treatment just 2 weeks ago, and Prolia shot is due May 5th. Should I get Xgeva?
Xgeva,
yeah. Xgeva shot before.
Yeah, so Prolia and Xgeva are the same drug, basically. They're just differently marketed, one for osteoporosis, one for myeloma. And Xgeva is the one that is approved for myeloma. So we usually recommend that. And the dose and the dose is, I think, lower but more frequent. I don't do osteoporosis so much. So I would recommend the Xgeva because it's approved. And continue with that, you usually have that once a month in the myeloma setting. And having had the Prolia before might actually be beneficial for you because it's still in your system. It's not as long in the system as bisphosphonates. They stay in the system for years. But the Prolia and the Xgeva, and that's not promotional, it's just denosumab is not the product name, but the generic name. They are both good for myeloma, but the Xgeva is the approved version.
Okay. Bev also asks, any tips for those on dialysis? Already quite active, no bone lesions or pain.
Yeah.
I think there are no exclusion.
As long as you have no fluid overload, like
yes.
example, right before the dialysis, you should be fine.
Yes.
Yeah.
Perfect. 2 more questions. Anonymous is asking, should one ride a bike outside or not due to risk of falling off the bike?
That's the same as Jens already mentioned. It is a very, very good exercise, especially because it's very joint friendly. But the falling risk is very high. So it depends on how safe you are on the bike and how good your balance are.
I have patients who have actually a tricycle, which kind of takes away this risk of falling off the bike. So they have 2 wheels in the back or 2 wheels in the front and one on the other end. So that is something that could work. But again, as Michaela said, the risk is not the bicycle itself, but it's falling off or being run over by a car or another bicyclist, which is really sad, but it unfortunately happens. Yeah.
It happens to everybody.
Yeah, right. Independent of myeloma or not.
Yes. All right. Last question. Olivia is asking, would like to resume Zumba. However, I just started RVD regimen in January and I'm experiencing terrible swelling in my legs, ankles, and feet. Are there any exercises you would recommend to combat the swelling?
Good question. I think the issue is not doing exercise, right? It's rather.
It depends again. Yeah. Unfortunately, it's always how we start our answers. It depends if the swelling is merely from the dexamethasone that you get or from kidney function, then it's not as dangerous. But if it's from the heart function, which can be differentiated, as we mentioned, by a cardiologist, then you should be very careful. Moving your muscles in general is also good for to get the fluid out of your system, because the muscles squeeze out your blood vessels and squeeze out the fluid back into your body so that your kidneys can excrete. What I would think, and that's just kind of a best guess, it's not a clear recommendation, but moving your ankles and moving your legs carefully, slowly might help to kind of massage the fluid out of the system. It will not be enough, but what you can also ask your doctor.
Like going on your toes back and forth. Yeah. That helps your muscles to get the fluid out of the feet back into the heart.
And what helps too is compression stockings that give you basically something that your muscles can squeeze out the vessels too.
That's what I was actually going to ask, if you'd recommend compression. So great. Yeah. All right, we are going to end there. Thank you so much to everyone for their questions and participation. And thank you for your presentation and all of your answers. Just always so insightful. So I'm amazed at the results that we've seen from the studies that we've done, and excited to see this progress even more. So grateful for these tips. And so just to finish, want to thank you all for your support for our myeloma crowd community, and that we can keep growing these webinars. Our next chapter is going to, fitness chapter is going to be May 5th. We're going to do a strength training demo class. So we're going to take what we learned today and show some modifications and how you can apply it at home in a safe way. And so we're going to have a cancer exercise specialist help us with that. And if you are, you don't have to be fit to attend this class. You can participate at home, learn some new things. We'll be talking about how to adapt these exercises with your pain. You know, pain be your guide. Always talk to your doctors. So our upcoming events for other chapters, we have on Saturday, April 10th at 12 Eastern Time, the Myeloma Crowd Roundtable and other targets, the BCMA and other targets on myeloma therapy, and then Tuesday, April 13th at 6:30 p.m. Pacific Standard Time, the SoCal Community Myeloma Chapter, how to build and grow our myeloma communities. And finally, Thursday, April 15th at 7 p.m. Eastern is our Myeloma Caregivers Chapter. Diana Valentine will be joining us as a guest speaker to share her experience as a caregiver, as well as give her top recommended financial resources for caregivers to know their myeloma journey. As we all know, these treatments and procedures are anything but cheap, and costs truly add up. So learning from others is always helpful. The link to sign up for any of these events can be found at the bottom of the slide. And again, will be sent in our follow-up email. Another thank you to our sponsors, without whom we would not be able to do this, is Bristol Myers Squibb, Amgen Oncology, Caropharm, Therapeutics, AbbVie, Adaptive Biotechnologies, Genentech, Oncopeptides, and Takeda Oncology. So another thank you to each of you and Dr. Jens and Michaela Hillengass for helping us grow our myeloma crowd community and our fitness events. So thank you, and hope you guys all have a great night. Thank you.